Greetings, I'm Dr. Noor, Maria, resident neurosurgeon from Pakistan, and today the topic of my presentation is the scope of epilepsy surgery in the low-middle income countries. The distribution of epilepsy worldwide is 2 to 3%, but the distribution is actually a bit unequal, with 80% of the epileptic patients belonging and residing in the low middle income countries. So it is basically a very serious problem of the low middle income countries. Epilepsy surgery has been performed for intractable epilepsy. In low middle income countries, about 73 to 75% patients do not receive any medication treatment for their epilepsy. Even if a patient is receiving adequate treatment, about a third will suffer from refractory epilepsy. In our study, we performed a survey and also performed a literature review. In our survey, we included doctors from low middle income countries, including Pakistan, India, Bangladesh, Iran, Iraq, and Syria, and we inquired about the availability of epilepsy surgery, any dedicated facility, any national guideline, national training programs. If the resident surgeons have been exposed at least once to the epilepsy surgery in their careers, and what is the assessment of the patient interest in getting operated for their refractory epilepsy, and what is the interest of the doctors in getting trained and specialized in this field. So we came to know that according to WHO, along with the ILE and the IBE, about 13% of the low middle countries only have surgical facilities available for epilepsy surgery. In our study, I want to share that in Pakistan, the first epilepsy dedicated unit was established in 1989 at the JPMC, and it did not have any surgical facility. Later on, Al Khan University Hospital, which is a private sector hospital, established a surgical center. In other low middle income countries, level 3 centers are available in Thailand, Philippines, and Vietnam. Indonesia and Thailand also at least one for level 4 epilepsy center. And more than 39 centers are performing routine surgery in India, epilepsy surgery. So in India and in Bangladesh, it is rapidly developing. Many young neurosurgeons of our generation, especially working at the public sector hospital, have not been exposed to this surgery at all. Only 10% have admitted to have observed at least once and any sort of surgical epilepsy surgery operation. And the commonest epilepsy surgery operation that they have seen is the anterior temporal lobectomy. 25% had epilepsy surgery performed in their countries. 60% said that they find patient interest in epilepsy surgery if this facility is available. 30% had at least one dedicated epilepsy management unit in their country. 60% neurosurgeons showed interest in joining epilepsy surgery as their specialty. Only 20% had a national training program. When we inquired about the challenges, most of them was like this is because of lack of trained personnel who can train the other neurosurgeons. 70% mentioned that their hospitals are not well equipped, and 60% mentioned that the cost of surgery is the biggest challenge. So we conclude that epilepsy surgery is an underrated and underemphasized surgical specialty in the low middle income countries where it is needed the most. So there is need to raise awareness regarding this sort of surgery so that we can have a better outlook in the near future to provide a better management option for those who are suffering from retractable seizures. While patients do intend to look for surgical options, they do not have that much of awareness, and they do not obviously have the facility to provide this. And there's also a lack of trained staff to perform this surgery, a lack of healthcare unit, as well as a lack of specialty training. So this can all be addressed by raising awareness campaigns. Thank you so much for a patient listening. I want to add just a little. The preventive step for epilepsy surgery, as we know that there's an unequal distribution of epilepsy surgery in the low middle income countries. Those factors which actually contribute in that relatively more more incidence in the low middle countries is because of perinatal injuries, CNS infection, and trauma. Epilepsy can be prevented thus by proper perinatal care, the law enforcement to prevent head injuries, and treating the CNS infections in time. A study from Tanzania suggested association of adverse perinatal events with epilepsy. So these are important points to consider. Thank you for your patient listening.